Hey guys, this is Dr. Bashir with Cypress Oral Surgery. Welcome back to the channel. Today we're going to talk about a special situation that can happen. It is a complication of wisdom tooth removal. Usually happens in the older population, but it can also happen to young people who are immunocompromised, meaning their immune system is not that great or they don't have the capability to heal well. So let's jump on in. This is a 72-year-old gentleman. He came to our office because he was having pain on the lower left side. And if you notice, on the lower left side, he's got a wisdom tooth right there. You can kind of see it. It's a wisdom tooth, and it is infected. It's infected, and you can see all that darkness in this area. This means this tooth has a cavity, he was having pain, and the tooth needs to come out. Now, taking out teeth in a 72-year-old person is pretty difficult just because the bone is very hard, and a lot of times we have to do a lot of surgery to get these out. Here's another 3D view. You can kind of see how the tooth is not fully erupted. In order to remove this tooth, you really have to remove a lot of bone. You have to remove all this bone, and I'll show you kind of what we did to get this tooth out and what problems arise from this issue. So the patient came back. This is 2 weeks after surgery. We took an x-ray. Everything looked okay. You can see the tooth is gone. We had to remove a lot of bone to get this tooth out. You can see the patient, there's a lot of darkness here. This is all areas where bone was removed to get this tooth out. The patient continued on having pain. We put him on antibiotics, gave him some pain medicine, and told him to come back in a couple of weeks. Here's the hole that we had to make in order to remove this tooth. And the patient comes back, and we actually lose him for follow-up, but he comes back about 2.5 months later, and now he's hurting a lot more, and now he's experiencing numbness. But when you take an x-ray, you can see that the bone is going away. You can see the bone is kind of as if somebody's eating, there's something that's eating the bone away in the left lower jaw, and right away we really suspected a condition called osteomyelitis. Osteomyelitis is chronic infection of the bone, and you can see right in this area it looks like something kind of is eating the bone away, and this is not normal. The body should not be like this, and anytime you have a chronic infection in the bone, those infections are extremely difficult to get rid of. Very, very difficult. And so we knew this is what this person has. Now, typically oral antibiotics do work for this, but usually you need IV antibiotics that are a lot more powerful because the bacteria that's in there is virulent, meaning it's tenacious and it doesn't respond well to oral antibiotics. So we sent him to an infectious disease doctor to manage this. This is what this person got. This is called a PICC line. It's a long-term IV catheter. It usually stays in there for a couple of months. The treatment for this was 6 weeks of IV antibiotics. We bring him back this is 4 months after surgery, or really about 2 or 3 weeks after he started the IV antibiotics. So you could see it's not getting any better, and you're not going to see symptoms get better on the x-ray. However, the patient was feeling better, but also one thing I want you to notice is that the bone is starting to get really, really thin in this area. Right here is starting to get really thin in this area, and the patient was at risk of fracture. Now, if he fractures, we are going to have to put a titanium plate in this area like this. We put a little titanium plate if he fractures. Now, we told him to be on a soft diet, really liquid diet, until this heals, and we sent him on his way. The patient was very, very compliant, and he followed up. And it's IV antibiotics once a day, every day, for a minimum of 6 weeks. This person got it for 2 months. And as you can see, this is 4.5 months after surgery, and you can see the bone is starting to look a little bit better, and the patient's symptoms were completely gone. He didn't have any pain or anything, and you can see the wound inside his mouth was healing well. And here's about 4 months after the IV antibiotics. At this point, he's no longer on IV antibiotics, but you could see the bone is healing and it's trying to consolidate, but it still hasn't healed 100%. And so we followed up with this person. This is 6 months later, and you can see the area is starting to look a lot better. And here is 1 year after IV antibiotics. So you can see the jawbone healed back to where it needs to be. However, it does take a very, very long time until you see these changes on x-ray, and now it actually looks normal. And this took 12 months. So just want you to be aware that these things take a long time. Bone heals very, very slowly, especially somebody in their 70s. Now, what happens if the person doesn't heal well, and then we have to take him to the operating room? And this is an example of us, we had to resect all the dead bone, and we took this person to the operating room, and we put a titanium plate. That's what the titanium plate looks like inside the mouth. And this is what the x-ray of this titanium plate looks like. And then we actually grafted this area, and this is about 18 months after surgery, and you can see the bone is healed back up. So sometimes if you ignore these and or the patient, you lose the patient to the follow-up, then you really have to do very big surgery. So osteomyelitis, when you start seeing changes on the x-ray or numbness in the lower jaw, a lot of times you have to jump on this right away and send patients to the infectious disease doctor and get IV antibiotics started. Otherwise, you end up with a jaw resection and a big titanium plate. I hope this is helpful, and please subscribe to the channel. Let me know if there's anything else you guys want to talk about, and have a good day.